What we should be aware of is that brain metastases are a very important problem for patients with metastatic breast cancer. However, we have little knowledge of the biology, in particular the immune biology of brain metastases. This is because not all patients forego surgery, so it's really very difficult to study biology in this context. So what we did in this study was identify 41 patients with breast cancer brain metastases which underwent surgery. These were HER2-positive and triple-negative breast cancer brain metastases. And we analyzed using a multiplex immunofluorescence panel, which allows both to analyze the immune biomarkers and at the same time maintain spatial notions. So we know not only which biomarkers are present and their density, but we also know if these are near to each other or in fact if they're far to each other. So with this kind of knowledge, we identified that in HER2-positive breast cancer brain metastases, the interaction between PD-1 and PD-L1, so the fact that there is a special interaction, which is identified by PD-1 and PD-L1 being nearer than 20 microns, which is something which can consider a spatial interaction. In fact, this interaction is significantly associated with worse prognosis in HER2-positive breast cancer patients with brain metastases. And this interaction was mainly due to the interaction between PD-L1-positive CD163, so M2 macrophages cells, and PD-1-positive CD3 cells. On the contrary, in triple-negative breast cancer brain metastases, as we can expect, a variety of immune interactions were had the prognostic impact, and this was a positive prognostic impact. So, in fact, immunity as taken globally as a positive prognostic impact in triple-negative breast cancer. What was really interesting, I think, is the identification of the PD-1, PD-L1 interaction in HER2-positive breast cancer brain metastases and its negative prognostic impact, because this might be a potential therapeutic target in this setting. For example, for clinical trials studying the combination of anti-HER2 therapies and immune therapies, anti-PD-1, PD-L1 antibodies, for example, in this setting.